Hi all, thank you for joining us for this third webinar in a series on the use of complexity-aware methods in evaluation. I'm Jessica Farringer, Associate Director for Data for Impact, and we have four of us presenting today. There's myself and Abby Cannon, who's the Gender Portfolio Manager and Researcher with Measure Evaluation, Mahua Mandel, who's the Monitoring and Evaluation Research Associate focusing on gender and youth, and Lisa Parker, who is the Orphans and Vulnerable Children Portfolio Lead for Measure Evaluation. Just to give you an overview of what our structure will be today, first, Mahua is going to go through an introduction to ripple effects mapping. Then we have two case studies applying ripple effects mapping. One I will do for Tanzania, and then Lisa will present on Botswana REM experience. And then Abby Cannon is going to come in and bring things together and share some lessons learned across both of these experiences. And with that, I will pass things over to Mahua to take us through an introduction.
Thank you, Jessica. So we'll start with talking a little bit about what is the REM mapping method. Ripple effect mapping is a participatory group method that is used to evaluate the impact of complex programs or collaboratives. So the method engages both program and community stakeholders, and it retrospectively and visually maps the effects that result from a program or a complex collaboration. So retrospectively means that you're looking back at what has already happened. REM is not only a powerful tool for documenting both the intended and the unintended results of a program or a collaborative, but it's also been used as a way to engage and to re-energize community members around a shared goal or a program. So where did REM start? It was first used between 2007 and 2009 by researchers from the University of Minnesota in the United States. And it was used to conduct an impact analysis of something called the Horizons program, which was an 18-month community-based program delivered to strengthen leadership to reduce poverty in the US. The method was piloted in 3 US states to illustrate outcomes of the program over time. And while there were minor process variations in each state, the technique in all of the 3 states used maps to illustrate to the community members what was actually accomplished, as well as to increase and further their enthusiasm for taking action on issues around poverty and other things that the program developed and was implementing. So why would one use REM in an evaluation? Ripple effects mapping is well suited for complex evaluations when it might be difficult to deductively identify possible outcomes or impacts. The method is participatory, so it engages participants and stakeholders around a specific intervention, and it, as I said, it can create energy for action. The structure of REM also helps to ground truth the theory of change, and it provides insights and discussion while also uncovering unanticipated consequences of a program. So what does REM require when you're using it in an evaluation? Because of its group participatory nature, conducting a ripple effect mapping evaluation requires both facilitation and evaluation skills. Sessions facilitators have to have strong skills for engaging the group in meaningful discussion, create open communication, and organize the time. At the same time, the facilitators have to use evaluation research skills that include things like group interviewing and analyzing qualitative data on the fly, meaning while the REM session is actually happening. And they have to engage participants in the process of generating and refining thematic categories and also uncovering the causal pathways among the ripples or the effects that the participants report. So how do you conduct an REM? This is just a quick process overview, and then I'll go through a little more detail what the steps involve. So the first step is appreciative inquiry interviews, which are basically peer interviews among participants. And then the second step is group reflection and mapping based on the appreciative inquiry interviews. And then you might have specific introduction and conclusion process based on your approach that varies from evaluation to evaluation. So the first part is the appreciative inquiry interviews. In this part, the facilitators ask participants to pair up with someone, and then within each pair, each participant interviews each other, and each person asks the other a standard set of questions, and this is given to the participants ahead of time. So the participants may ask tailored follow-up questions to clarify the partner's response, but they stay on topic. And each person should be an interviewer and an interviewee once. So they basically take turns to interview each other and to answer the questions. The facilitators should keep time and announce when it's time to switch the role of interviewer and interviewee. And then all the participants come back together and share in the next part. So during this appreciative inquiry interview portion, the facilitators should encourage participants to take notes as they're interviewing. The next part is the group reflections and mapping. So after the peer interviews, the participants come back together as a group to reflect. And the facilitator asks each pair to either offer one story or one outcome from a story that they had discussed in their pairs. And the facilitator asks only one so that every pair has an opportunity to share. And some of the things that the facilitator probes on are asking then what happened after whatever story the participants share. Who is involved? What skills or approach or tools were involved? How are people doing things differently? And have relationships changed as a result? So these are just some of the examples of things that facilitators can ask. So to map the program, you start with the program in the center, and then you ask one group to share their story or one effect the program had on the participants or the community. So you add that effect, and you write that down with a connection to the program as is here. Then you might probe a bit more to find out what happened after that, and you write that down, and then you probe some more. And after doing this, you should encourage the group to speak up and say if they had different experiences. And when you ask that, you might find that someone had something else that happened, and you write that down along with those ripples. So you keep doing this, and you go around until each group has shared and there are no more effects to share, and you write them all down. So you get this broader map, and you can see how things move out from the center where the program is, like ripples outside of the program. So the next step is the preliminary analysis, which is part of the group reflection of the map that you had just created. So you have the collective map of effects, and then the facilitator asks the group to reflect on the map as a whole. It's an open participatory discussion, and some of the questions that the facilitators may ask are things like, what's the most significant or important ripples that we have on the map, or how are these ripples different from each other, or is there anything that's missing from this map? So that's a basic overview of how to conduct an REM. And now I'm going to hand it back to Jessica so she can talk in detail about how this method was used in Tanzania.
Thank you, Mahua. So under measure evaluation, we applied the method in Tanzania, obviously, and I'm focusing here on the methods, not on the outcomes of the research. There were multiple evaluation questions in this midline evaluation, but the REM component fell under this question. I've highlighted the community engagement and governance piece specifically because that was the topic our REM sessions explored. But you can see here We were looking to qualitatively examine perceptions of program implementers, community members, and other stakeholders on performance and influence of the Public Service System Strengthening Project on uptake on a number of areas, so uptake of health services, finance, human resources, and community engagement and governance. We used a mix of qualitative methods to get at perceptions from different kinds of stakeholders. We used REM to explore outcomes of training PS3 had held with local government authority, or LGA, counselors. PS3 trained counselors to improve their knowledge, skills, and attitudes on a variety of issues, including their roles, responsibilities, and rights, and managing LGA human and financial resources. For cost reasons, we knew that we had to do group discussions with counselors. We chose to use ripple effects mapping because of its more participatory nature, and that because we appreciated the potential of the visual mapping component to encourage more interaction, spark memories, etc. We conducted the sessions in 6 local governance authorities spread across 3 regions of Tanzania. We conducted 1 REM session per LGA, and we had about 8 LGA counselors in each group, and we mixed men and women in these groups. We selected counselors based on their participation in the PS3 training and also to represent a range of local vulnerabilities such as higher income versus lower income, urban versus rural, etc. And we had 3 facilitators. We had the main facilitator, who's the person that was asking the majority of the questions, the person who drew the map, our mapper, and a third person who took notes and also tried to capture direct quotes. We did not audio record sessions. In our training, we went over the LGA counselor content first. So we wanted them to be very familiar with what the program was carrying out with the counselors. And then we had already received from the program some feedback that they had collected from counselors after the training. And so we reviewed example statements made by the counselors during those feedback sessions. So then our team had an even better understanding of the kinds of outcomes that we might be seeing in these sessions. We also shared the field guide to REM mapping developed by the University of Minnesota, and researchers reviewed this. We walked through in a PowerPoint presentation the steps involved in ripple effects mapping. And then we carried out a mock REM session in which 2 measure evaluation staff acted as the facilitator and the mapper for a topic common to the researchers. Here's the practice activity we did under that mock session. It was challenging to come up with an experience that was shared by all of our researchers, but we settled on their bachelor's degree program. We had them pair up to do the appreciative inquiry exercises with these questions and some other questions, and then have everyone come back together as a group, and we went through the mapping and reflection processes together. We then switched to our actual research topic and carried out another demonstration. This time, though, we had the 3 people who we had already designated would be facilitators in the field practice leading a mock session with the real content. Then the other researchers played roles of LGA counselor participants. We assigned roles such as you are the rural area counselor who's very quiet, or you are a very loud and opinionated counselor who thinks her opinion is the only valid one, etc. And then after that session, we did a pilot with LGA counselors in the field. So now let's turn to implementation of ripple effects mapping. I have for you just a few of the appreciative inquiry questions we used in the REM sessions with LGA counselors. So for example, we had, tell me a story about how you've used the information or tools received through the PS3 counselor training and mentoring. What's an achievement or success you had based on your experience with PS3 training? And what new or deepened collaborations with others have you made? For the mapping component, we then asked each pair to offer one story, and the facilitators probed further to draw out details of the outcomes and to get farther along the causal chain. They asked questions like, and then what happened? Or what skill from government of Tanzania, the government of Tanzania and PS3 trainings was involved? What are people doing differently, and how have relationships changed as a result? Here is one of the maps that came out of one of the sessions. This is translated into English. I'm not going to pause long enough to read through these, but just to give you an idea of what it looks like afterwards. And we tried to, you can see, use different colored markers for adjacent lines of ripples so that it was easier to tell that they were separate ideas and outcomes. So once we had a map drawn, we had the group reflect on this map as a whole. We asked things like, what's the most significant change on this map? Or what other effects or impacts would you like there to be? And what should we do next? For analysis, we had the maps and notes translated from Kiswahili into English, and we entered the mapping data into a software called Mind Manager. We then reviewed the maps and identified additional connections between related outcomes. We also identified any commonalities across locations. We compared the maps with themes that had emerged from the evaluation's qualitative data from individual interviews. And then we also used notes to provide deeper insights, and quotes were linked to corresponding threads on the Mind Manager map when possible. And with that, I will pass things over to Lisa Parker to share the experience in Botswana.
Great, thank you. So for this evaluation in Botswana, the objective was to qualitatively examine how factors at the personal, family, school, community, and service delivery levels influence the education, economic, and health trajectories and related outcomes of OBC. The ripple effect mapping was one qualitative component. There was also a quantitative component of this study, and in-depth interviews with caregivers and youth as well. There were a total of 4 REM groups conducted. 2 included HIV negative participants, and 2 included HIV positive participants that were part of an already established youth support group. There were approximately 8 participants per group. Youth were ages 16 to 19 years old and had received USG services for OBCs. In the Botswana example, we used 2 facilitators. One was the main facilitator and the other was the mapper. The 2 facilitators reviewed a training PowerPoint as well as the field guide to REM mapping. A mock REM group was conducted with the data collectors being trained for another qualitative component of the study. The data collectors role-played as youth beneficiaries to try to make the experience for the facilitators as realistic as possible. Then a pilot REM was conducted in the capital city. Conversations between pairs of participants were audio recorded in the case of Botswana and included the following questions, among others. Tell me a story about how you have used the information you received or skills learned through the project. Has the project helped maintain or improve your health? And discuss an achievement or a success you had based on your learning from the project. What made it possible? In the pilot REM group, the participants were distracted slightly by the live mapping, leading them to focus on the color or exact wording of what was being written. The mapper moved to the side of the room and mapped the conversation, and then brought it back to the group to react to at the end of the session for future REM groups. Some youth were hesitant to share their stories initially due to the sensitivity of the information being shared. So in order to address this, the facilitators reassured them about the confidentiality of the information they were sharing and The youth also decided to come up with creative pseudonyms, which provided some levity to the REM groups. As mentioned, the facilitators presented the map back to participants at the end and explored whether the beneficiaries thought the map was a true reflection of their discussion and or had any gaps. Participants used the time to reflect on what was the most significant change identified on the map. And the visual map itself really supported this process of identifying the most significant change. We also found that more concrete questions around most significant change were easier to grasp for the participants than questions about what was interesting about the map. So in the case of Botswana, the live maps were photographed and validated after listening to the audio transcripts of the session. Additional details were then added and vague concepts were clarified. These maps were then replicated in the XMind mapping software. The maps and written transcripts were reviewed to identify emerging themes, perceived results of the project, and the perceived impact of those results. So here's an example of an REM map that was developed during the session with the youth in Botswana. And here we have an example of how the data looked once entered into the XMind software. This shows the content areas in different colors, as well as the multiple pathways originating from each outcome identified. So 2 of the maps were illustrated by a graphic designer in collaboration with the study team. The study team distilled the information from the XMind maps into thematic areas and then consolidated pathways of outcomes in each thematic area so that the program outcomes could be presented in a more easily digestible format. And here you can see a section of the illustration on psychosocial support, highlighting 3 thematic ripples, including confidence, stigmatization, and accepting of one's HIV status. Now I'm going to hand the presentation over to Abby Cannon.
Great, thanks, Lisa. So I'll take just a few minutes to kind of bring it back together, talk a little bit about the advantages of REM that we found to be true in our experience, and then move on to some lessons learned from both of these studies. First, we just want to highlight some advantages. We found that post-data collection analysis time was reduced when compared with analysis time for typical focus group discussions. This is primarily because the mapping sessions are essentially participatory analysis of the intervention effects in real time, and it yields a map that has all the outcomes already on it. The map is also a useful tool to instigate further discussion and details about intended and unintended outcomes and consequences during the REM sessions and afterwards. And the final maps created a sense of pride and accomplishment among the respondents, so people enjoyed participating in the sessions, which was also great. So some lessons learned around facilitation. We did find that facilitation is a big key to this method, and the facilitators should be well trained in group facilitation and management skills to ensure that all participants have the opportunity to share and the discussion group stay focused. For example, facilitators should be able to manage a group with some outspoken leaders, as well as shy people or a group of quiet people, and be able to draw them out and draw out some of their own experiences. Mappers should also be well versed in the program components and theory of change that's being looked at, and that person should have the analytic skills and adequate training to distill key aspects and examples of the evaluation. This will help the facilitator and participants make connections and identify themes during reflection. So basically for the mappers, we do want to just stress that needs to be a person that actually has a knowledge of the program and understands the methodology, and is not just a person that's capturing words on the whiteboard. They need to have a little bit more of a larger picture and analytic training.
So for example, the mapper should be able to notice that various examples, different examples that also pertain to the same example. So we have specific examples of increased self-confidence related to studies or school, such as somebody being willing to raise their hand and ask a question, or having better relationships with teachers or friends. Both lead to improved school performance. And so this would be a theme for the mapper and the facilitator to pull out and highlight for discussion. And this takes a little bit of practice and analytic thought on your feet, on the fly, on behalf of the mapper, to really identify those themes and highlight them in real time. Other lessons learned, we just found that practice is important with any new methodology. This is crucial. So we recommend a couple of different practice sessions. As Jessica explained, in Tanzania, they did a practice session that measure evaluation led as the facilitators, with the facilitators in training acting as participants using a real example, in their case, the bachelor's degree program, so that they actually understand what an REM session is supposed to look like and feel like. Then switching roles around, doing a mock REM session of a study topic in which the facilitators in training, so the ones who will be delivering or facilitating the REM sessions, would play the roles of the facilitators, as well as some of them may be playing roles of beneficiaries or participants. And so that would also allow them to practice the type of themes and outcomes that might come out during the actual study topic facilitation. And finally, we do recommend 1 to 2 pilots to ensure the facilitator and the mapper are well prepared and have practiced some of that live mapping and analyzing. And that would be with the actual study population. If 2 pilots is not possible, then we would recommend maybe doing another mock REM session. Other ideas for training: it is important to clarify that relationship between the facilitator, mapper, and the note taker, if there is one. This just makes sure that the facilitator checks if the mapper is capturing outcomes, and the mapper clarifies if there are any questions or things that they've missed. If the conversation is moving quickly, the mapper should be able to pause or go back just to ask for clarification, and the note taker would be documenting any quotes. During the training, it was also useful for the REM trainees to give examples of possible stories from the program beneficiaries, so that they can practice mapping those actual outcomes, or what might come up during the sessions. And the facilitators would need to practice probing for detail. So that's also the asking of then what happened, and what happened next, and how did that impact the next outcome. Also, we want to clarify that we are looking for outcomes, not just activities or stories that should be mapped. So that may start from a story or a specific example, but that probing will help get to those outcomes as effects that we are looking for. When thinking about tailoring this, so this was, to our knowledge, the first application of REM in middle-income countries outside the U.S. So this was just an interesting experience for us. It was great. Everybody enjoyed it, and it worked well. We do think it's important to also consider the population with any study if it needs to be adapted to the context. So we found that, as Lisa mentioned, the youth had some trouble with understanding or getting distracted about the maps and what was being drawn. So it's important to just take a little extra time at the beginning to really explain what this process is like. People might not be familiar with participatory research, so explaining what it will look like, even doing an example, if that would be helpful for the population. Thinking about how you might word questions differently for youth versus adults, or with different education backgrounds. A lot of the same things you would take into account in other research tailoring. We also found that there is a difference in how complex your program might be. So in Jessica's example, Tanzania was really just one topic. It focused on governance and citizen engagement, and it had just a single intervention that they were looking at in the REM groups. Botswana was 3 different topic areas: health, economic, and education, and there was layered intervention. So it was a little bit more complex, and we had to divide up some of the questions at times to kind of focus on specific areas or interventions to really hone in on some of those. And during the mapping sessions, sometimes they were having trouble fitting everything on the maps just because there were so many ripples. So in that case, you could just add another piece of paper to your map on the wall if needed. As I mentioned, you just may need to budget extra time to introduce and explain the purpose and the process for people that are not familiar with participatory research. We want to clarify that you were looking for concrete examples with lots of detail. And then ultimately, we want to follow that out to the outcomes down the causal chain, not just stopping at outputs, such as I attended a training and want to know what happened from that training. And this will require that facilitators probe for those examples. So here a participant says, well, we learned how to manage finances. The facilitator probes, okay, so then what happened? The participant says, oh, well, I developed a budget and needed less guidance than normally do. And this could be continued to follow. And then what happened? Maybe the participant was able to save money to purchase something or something like that. As far as audio recorders, they can work well. They worked well in Botswana. It just depends on the space. Tanzania, the spaces were smaller and noisier, so they did not use them and used a note taker instead, which also worked well. If you're not using an audio recorder, we'd recommend holding a quality check after the session, and that would include the facilitator, the mapper, and the note taker to make sure that to clarify any notes, make sure the quotes are on track, and fill in any gaps as possible, as early as possible. So in conclusion, we really enjoyed using this methodology, and we found REM to be an engaging and interactive method to visualize outcomes that may not be captured otherwise. We found that maps can be used to compare an intervention's a priori theory of change to participants' lived experiences. It also can be used alone or in combination. In both of these examples, it was used in combination with other evaluation methods. And it can also, unlike some other methodologies, can be helped to further the effects of an intervention. Here we have some acknowledgements for everybody who contributed to each of these studies. They had whole teams of people working on them. So I'll leave this up for just a minute, and before we will then move into question and answer. So if you have questions, please type them into the question and answer box on your webinar, and we will take a quick pause. We're going to mute ourselves, read some of your questions, and we'll be back in just a minute.
Okay, so we have a question here looking at getting at attribution when using this method, and whether and confirming that the outcome you are hearing from participants was actually due to the program. And the question includes asking about using a but-for question. So I'm assuming it would be something like, would this outcome have happened, if this program hadn't taken place? We did not ask that question specifically in either of these case studies. However, I know in Tanzania, we had to have the facilitators from time to time clarify that the outcomes they were getting at were directly related to the experience of the training, because it did become clear at several points that they were veering off. In Botswana, that was similar.
Yeah, I think it was similar. There were some cases where there would need to be some disentangling between just a friend supporting them around something on stigmatization versus the project messages around stigmatization. So the facilitators tried to manage that.
Mm-hmm. Right. But yes, you could easily ask these kinds of questions to clarify that from the get-go. The challenge, particularly with this method, is that the facilitators do have to be, I'd say, more skilled than those that would be doing a typical focus group discussion. So when you start getting into these kinds of questions, it gets even more complex. So you just have to make sure that you have a very, very well practiced and prepared facilitator.
Yeah, and I think part of that is also that the facilitators need to be intimately knowledgeable about the program, because then they can help to clarify, like if there's some outcome that a participant has shared that is clearly not part of the program, then a facilitator who is knowledgeable about the program wouldn't necessarily kind of spend the time that's not necessary to keep probing on that. So I think knowledge of the program is important for this piece as well.
We have a question. In the mapping process, is the facilitator building the map using pens and whiteboards or some sort of software? In both of our experiences, we used paper and pens. We had different colored markers to draw out the different lines of outcomes so that it was less confusing. You could easily use whiteboards. We didn't use software because definitely in Tanzania, the setting would not have allowed for that. And I think it would have complicated things and made things maybe less accessible for the participants. But you could do that, depending on where you're doing it, if you had a screen where you could project the map as you're building it.
I think in the examples I've seen in the US, it's always been done on white paper and pens, because it's easier to cross out and it's more efficient.
Mm-hmm. We have a question. Who should participate in the REM meeting? Is it project implementers, beneficiaries, both? We worked with beneficiaries, as did Botswana. You could definitely do it with project implementers. It just has to be someone that would be familiar with these chains that you're trying to ripple out. So we have, this sounds like a wonderful qualitative participatory method. How is it usually complemented by quantitative data collection and analysis? So in Tanzania, we did not have quantitative data that got at community engagement and governance. We were using routine data, and there just wasn't any related to that topic, so we did not have that complementing process. But I don't know if Mahua, you want to talk about Botswana?
Sure. In Botswana, we did have complementary quantitative data. We had household data from the orphan and vulnerable children beneficiaries, as well as their primary caregivers. So it was diet quantitative data. In terms of how it is complementary, I don't know if it's really any different from, in general, how qualitative and quantitative data can be complementary. We used some of the quantitative data to triangulate the qualitative and vice versa. We used the results of the REM maps to explain some of the quantitative results that we saw, and especially when we saw some unexpected quantitative results. We did have a control group and a comparison group, and so if there was some result that came out of there that was kind of in the wrong direction, we turned to the qualitative data, including the REM data, to try to explain some of that. So I think when you use, whether it's REM or other data, it's the same sort of process that you use to triangulate.
And you can find on the Measure Evaluation website, we have a combined quantitative, qualitative report for Botswana, as well as separate quantitative and qualitative briefs. So you can kind of see how we use the data that way.
There's a question about, do you have to have a very skilled facilitator? I believe we answered that previously under another question, so I will mark that off. So is there a concern that the appreciative inquiry element may bias towards positive factors versus negative factors? Yes, absolutely. We specifically had facilitators in Tanzania ask about potential negative outcomes as well, because it definitely could bias towards the positive.
Yeah, I think in Botswana this was a struggle. You know, we did find that the REM led to following the ripples of more positive outcomes. We struggled a little bit getting negative outcomes, and we also struggled a little bit getting those unexpected outcomes. And so, you know, we really did use it to kind of get their perceptions around how it positively benefited them, and then triangulating that with some of the quantitative data that was showing maybe there wasn't as much an impact in some areas. So at least in the Botswana experience, I think that was a concern for us with this method.
There's a question, should the mapping always be done live? Yes, that's one of the key factors of the method, is having that visual component and being able to reflect upon all of the pieces that people have been talking through. What size are the groups REM is ideal for, and how long did you allow for the live process? So I think it's the same as a focus group discussion. We had about 8 or 9 in each of our groups, and that was a manageable size. What did you do for Botswana?
Yeah, we had around 8.
Yeah, 6 to 8 we said, and we ended up having about 8.
Mm-hmm. The groups get much larger than that. You would just have endless numbers of stories and whatnot. I imagine it would go much longer than the participants would have available for you. And on that note, how long did you allow for the live process? Ours for Tanzania wound up being a little under 2 hours each. Is that similar for Botswana? Mm-hmm. So it's longer than a typical focus group. You have those 2 pieces with the appreciative inquiry interviews first, and then the group discussion. So you have to allot more time.
So there's one question that's asking if we can talk a little bit more about using this method to ground truth, a theory of change. So what we mean by that is, since we're talking about evaluations, and the best practice in evaluations is to always start with the program's theory of change for how the interventions the program has implemented or will implement will lead to the ultimate outcomes that the program's looking for. And of course, sometimes the theory of change isn't as clear as is needed for an evaluation. So the evaluators work with the program implementers to clarify that. So you end up having this theory of change, and the ripple effects mapping, once you get the map, you can use parts of that map or be able to adapt that map in a way to basically compare whether the themes that have come up on that map are comparable to the theory of change. So generally the theory of change, you know, you're working with like some sort of framework with arrows, and that's a little broader than the, and it's not maybe as detailed as what you'll get from a ripple effect map, but you can look at that ripple effect map, that end map that you've created with the participants, and zoom out and then see if that basically, if you would be able to kind of overlay the theory of change, and if not, what are the differences between the theory of change and what the participants have said in the ripple effect mapping sessions.
I mistakenly deleted it, but there was a question about how this is similar or different from outcome harvesting. I haven't personally used outcome harvesting. Have you all?
I haven't used it. From what I remember reading about it, it's much of it is really going through reports, right? And so I think our outcome harvesting is really more secondary, reviewing products that have already been published or that have already been produced and reviewing those. And so the ripple effects mapping is live and it's with participants. And so I know that's a big difference.
Yeah, and I think in outcome mapping, they do go back and confirm it in stakeholder interviews, but it's not, the outcomes have already been harvested prior to that process. And here it's happening all at once.
And there's a guide that Mahua had shown the cover of from University of Minnesota. We'll make sure the link for that is in the presentation that we upload. In that guide, they specifically talk about how ripple effects mapping compares to other methods. Outcome harvesting is one of the methods they address, and that also most significant change in outcome mapping. We have a question, how are the pairs chosen or determined for the OVC REM?
We just allowed the participants to usually pick the person next to them. So they were just allowed to do that. We did find in one of the groups, I had mentioned they were already part of a youth support group. And we did find that in those groups, the beneficiaries were much more comfortable sharing stories. And then in comparison to the HIV negative group, where those participants did not necessarily know each other ahead of time. So that's just something to mention there.
And for that, all of our groups were female for the REM. So there's a question about capturing gender specific outcomes. So we didn't deal with that issue.
And we have a question about youth. Does anyone have experience doing REM with youth? And that was the Botswana experience, was all with youth.
Yeah, and I think we did find that it worked effectively with them. I think the big issue we had with them is just kind of initial shyness, curiosity. What's this data going to be used for? What are they mapping there? Why are they documenting this on paper? So it was a lot of reassurance and spending the time at the beginning, really walking them through the purpose and making sure that they were really comfortable in the process. But they seemed to respond to it quite well.
There's a question, can we say that REM is an advanced way of getting outcome reports from FGDs? Sort of. I mean, you start the analysis during the actual session, and that's the whole idea, is to get at outcomes during the session.
And getting them to add to certain outcomes different pathways that come out of the one specific outcome. Maybe different people had different experiences, understanding where more of them had the same experiences. So yeah, I think that's a nice kind of way of phrasing it.
We have what mechanisms do you put in place to make sure participants give answers based on things that actually happen and not what they think you wanted to happen from the project? We had challenges with that in Tanzania for sure. People gave very vague answers, and it was clear that these things hadn't necessarily happened. So that took extra practice and research for the facilitators, making sure that they knew as much as possible about the program and that they dug when somebody gave a vague answer. Give me a specific example of that.
Yeah, and similarly in Botswana, I think asking for specific examples is kind of one of the main ways that we try to ensure that we were getting details and that the details were things that actually happened. So we have a question: in complex interventions, outcomes are interrelated. Since there were 3 outcomes for the Botswana example, was the REM synthesized across the 3 outcomes? I think in the maps, we kept them separate. Is that right? There were, I think we did find some connections, some interrelationships. I think for the, and I can't remember the specific interrelationships. I think something like increasing confidence kind of went to the outcomes of education, economic strengthening, as well as health. And so I think what we ended up doing, if I'm remembering correctly on the maps, is something like that was then put on all 3 areas, right? So we ended up having multiple maps, but the themes that came out across the board were put into maps. I mean, I think the resulting maps are similar to anything else in research where you're taking complex relationships in real life and you're trying to distill them in a way that's understandable. And so it's not, it's not real life, it's a representation of real life. And so there is, possibly going to be some losing of the complexities.
And just to note that in the report, we did organize the report by the education, health, etc. So then the majority of the findings that are reported within the report were by kind of outcome area.
There's a question about other methods used in the evaluation. Both of the evaluation reports are available online, and we will make sure there's links to those so you can read more about the other methods.
We have a question about with mapping outcomes, can REM be used as a tool to help map effectiveness of the approach of a program? For example, is the approach we use effective? Do we need to change anything? And I think that REM could certainly be used to look at the implementation and approach. It just would be a different audience who would be using, the implementers, the programmers, and that would just be the focus of the REM session would be different types of questions in the appreciative inquiry and then in the mapping session. So it really could be a good way to look at what's working, what's not working, what are the gaps, what do we want to change. So this could be a interactive and fun way for people to sort of think through the approach and implementation. So good question.
There's a question, is REM good for HIV data analysis, especially on finding data that HIV patients are not willing to give out?
Yeah, I think we found in the HIV positive group that patients were really open about talking about really personal information around stigmatization, their experiences with disclosure. But I think this is not only the REM, but because they were already participants in this youth support group. So we were able, I think, to get even more information that you would get out of an in-depth interview when they felt comfortable talking about this experience with others that were having similar lived experiences. I think it did lead to more sharing of that information.
I would also add to that, that is, in that context, it was helpful to get information about their lived experiences of stigma and how the program had helped them. I would, just in case for how people might interpret this question differently, I would say that this would not be a way to get more HIV data or information about people that didn't want to share it otherwise. It's to be used in a confidential, safe space to try to understand better and those experiences, but should not be used to try to collect additional data about HIV, people that are, for example, trying not to share that they have HIV.
There's a question on how do we identify and recruit our group participants. In the case of Tanzania, where it was local government authority counselors, we purposefully selected them based on what wards they were in, because we were trying to represent a variety of different types of different wards that they were from.
Yeah, because REM is the beneficiary, the participants are either beneficiaries or participants of the program, so the recruitment has to happen via whatever lists or whatever data that you have about program participants. And so in Botswana, we had a list of various youth in different geographical areas who were participating in the program, and so recruitment happens through that, and particularly through the community-based organizations that directly worked with the youth participants.
In both Tanzania and Botswana, were these conducted at the end of each evaluation, or is this something that you can conduct perhaps at midline of an evaluation? So in Tanzania, it was a midline evaluation. The caution there, though, is that you have to have outcomes, right? So the program has to have been going long enough that the participants are experiencing changes potentially related to it.
Yeah, in Botswana, it was a cross-sectional, and it happened sort of between the middle and towards the end. So it was, I mean, we didn't call it either a midline or an end line because it was just one point in time. I think similarly, we ran into similar issues where some of the participants may not have been exposed to the intervention long enough to be able to share outcomes. And so actually when recruitment was done for both REM as well as the other qualitative portions of the evaluation, the researchers made sure that those who were recruited had been exposed to, you know, at least like 2 parts of the intervention for a certain length of time.
So let's see, we're at 10:01. We could answer maybe a few more questions here, but then we need to respect people's time here. Yes, okay.
So we had a question about the qualitative analysis software. It's very expensive in the developing world. Yes, we do understand that, and both MindMap and XMind can be used for free for either some period of time or potentially indefinitely. I can't remember which ones of those, but they're available for free, at least for a trial. So we did not have to pay for those licenses, so that those are available, and so that is a great option to save money and to make that accessible to anyone.
There's another question related to software. Can you discuss the difference between using XMind and Mind Manager? We only used Mind Manager, so I can't speak to XMind. Mind Manager there was a free trial at the time, so that was one of our major considerations. And also, they're asking why you didn't use the mind mapping software during the discussions. Was that purely technological, or you did not want people to focus on the software? It was both. We didn't want people to focus on the software. It's easier, faster to do things by hand. And we didn't have the technology and the locations that we were doing the sessions.
Yeah, and I think if you're working in low and middle income countries, it's just more accessible to the participants to keep things on pen and paper. There's kind of no reason to use a fancy software during the live sessions. There's nothing about the software that improves the process of analyzing with the participants in real time.
There's one we would like to know, especially for Tanzania, how did you account for social desirability bias by the participants, knowing they were being assessed for skill sets that were provided by the organization that provided the skills? We got at that a little bit earlier, talking about the positive bias in general for the method. In Tanzania, we did specifically ask about negative outcomes. We did not get many at all, however, so I'm sure social desirability bias was a factor in that. We made it clear that we were not from the program, and that presumably would have helped a bit, but no, social desirability bias is a major concern.
I mean, that relates to the next question too, and one way of looking at that or taking that into account is that we did have other data sources as well, especially in Tanzania, quantitative and other qualitative data to see if anything else came up in those data sources. But I think, as Jessica mentioned, that is going to be a concern in REM as well as many other qualitative data collection. People like to tell you the things that they like about the program, so it can be challenging to capture some of those barriers or gaps.
Just one more, and then we'll wrap up. Okay. Would you say REM is complementary to focus group discussions, or does it substitute focus group discussions? We used it as a substitute to focus group discussions. The purpose was to get at outcomes in a way that we would not have been doing using focus groups. I don't know.
Yeah, I think I would just add, in the Botswana example, I don't think it would have been that useful to have focus group discussions, but we did get really different data from our in-depth interviews. So I do think that ripple effect mapping is a great complement for in-depth interviews.
Okay, and with that, I think we will come to a close. Thank you to everyone who joined, and thank you to the other presenters. We will be having another one of these webinars next month, focusing on organizational network analysis. The announcement will be going out soon, and I hope you all can join us for that as well. We will, after this, send a link to the recording for the webinar and the slides as well.
And there's a new REM brief that was just recently published on the website that summarizes some of what we've talked about today. So we'll include that in the link with the webinar recording as well.
And with that, we close. Thank you all very much.